name is Lindsay, and today we'll be talking about salmonellosis. Salmonellosis is also commonly referred to as salmonella or food poisoning. Salmonellosis involves an infection in the intestines, especially in the lining of the small intestine. This infection usually leads to diarrhea, fever, and abdominal cramps that usually begins 12 to 72 hours after infection and lasts for a period of 4 to 7 days. Although in most cases of salmonellosis, there isn't a requirement for treatment at the hospital, but sometimes if the case is severe enough and the affected person has a weak immune system, like if they're a senior citizen or an infant, hospitalization may be required. According to the Centers for Disease Control and Prevention, salmonellosis, also known as food poisoning, causes 1.2 billion foodborne illnesses in the U.S. every year. Each year, it causes 19,000 hospitalizations and 450 deaths. To give a brief history of salmonellosis, we'll first talk about how it was discovered. Daniel E. Salmon is the man to whom salmonella is named in honor of. While Dr. Salmon was investigating the causes of cattle fever, hog cholera, and other animal diseases, his assistant Theobald Smith discovered a strain of bacteria belonging to the Salmonella genus in 1885 and believed it to be the cause of hog cholera. He discovered it while studying pigs. Smith named the disease in honor of Dr. Salmon. For over 125 years, it has been linked to many illnesses throughout the world. Bacteria belonging to the Salmonella genus are divided into two species, Salmonella entetica and Salmonella bongori. Salmonella entetica has 6 subspecies, and in fact, Salmonella bongori used to be considered a subspecies, but in 2005 it was relabeled as a subspecies. Salmonella bongori was discovered in 1966 in Bangor, Chad, which is where it got its name. The strain is often associated with lizards, but it can be found in other animals as well. And one fact, while we're talking about the history of salmonella, is that in 1975, the FDA banned the sale of small turtles due to the concern about the risk of salmonella spread. Any turtles less than 4 inches could be bought or sold. Next, moving to etiology or causative agents. So basically, when we're discussing about etiology of salmonellosis, we'll talk about the 2 bacteria strands that can cause it. The first one is Salmonella entetica. This bacterium is gram-negative and bacillus, or rod-shaped. Salmonella entetica can cause diverse types of diseases. Types of Salmonella entetica infection can include typhoid fever, also called enteric fever, which usually gives the infected human a high fever of up to 104 degrees Fahrenheit. Another type of infection is gastroenteritis, which is an intestinal infection that leads to diarrhea, vomiting, fever, and cramps, kind of similar to food poisoning. Salmonella typhimurium is a type of Salmonella entetica that causes typhoid fever. But probably the most well-known infection caused by Salmonella entetica is Salmonellosis, which is what we're talking about today. This disease is often referred to as food poisoning, as it usually comes from contaminated food or water. It is important to note, however, that Salmonella is not the cause for all cases of food poisoning. Another bacterium that can cause Salmonellosis is Salmonella bongori. It is also a gram-negative bacterium that is rod-shaped. Like Salmonella entetica, this bacterium also leads to symptoms such as cramping and diarrhea. However, unlike Salmonella entetica, Salmonella bongori is found in cold-blooded animals such as reptiles and amphibians. It may also be found in dogs and birds. The biggest difference to remember between Salmonella entetica and Salmonella bongori is that Salmonella entetica is usually found in contaminated food and water, whereas Salmonella bongori is mostly found on the skin and in the droppings of reptiles. So now we're going to talk about the reservoirs, or which organisms Salmonella bacteria can naturally be found inside of. Salmonella can be found in the digestive tract of most reptiles and amphibians. Usually the existence of Salmonella in the digestive tract of these animals does not cause it harm. These animals will naturally defecate the bacteria in the droppings, where it can then spread to other organisms and other places in the environment. Salmonella can also be found in intestines of farm animals such as pigs, chickens, and cows. It can also be found in raw chicken eggs. This is why if meat is not properly cooked before consumption, there is a greater risk of food poisoning. Salmonella can also be found in the intestines of affected humans, as well as in their circulatory systems if the infection is severe enough. Humans are not usually reservoirs, however, as if they contract salmonellosis, as soon as they contract salmonellosis, the symptoms of the disease usually show up within 12 to 72 hours, and the body will immediately begin to flush the infection out. Salmonella bacteria can also survive for several weeks without infecting a host. It can therefore commonly be found in polluted water, especially stagnant water, as well as in raw milk. Some researchers have found that cockroaches and wild mice can also become potential reservoirs for Salmonellosis bacteria. And then last, we're going to talk about, last for my part, we're going to talk about transmission, or how the Salmonella gets around from organism to organism or from person to person. Salmonella can be transferred from infected human to a human through direct and indirect contact. Examples include spread through saliva and spread through sharing contaminated utensils and drinks. Salmonellosis is usually contracted in the home due to poor kitchen hygiene. If meat, poultry, or eggs are not cooked long enough, Salmonella enterica may survive and infect whoever consumes the food. Furthermore, other examples of poor kitchen hygiene can include using the same knife or cutting board to cut meat and vegetables, not washing fruits and vegetables before serving, or not washing one's hands before preparing food or after, even just after using the bathroom. Salmonella rarely affects the appearance, smell. Salmonella can be transferred to humans from many different types of animals, such as dogs, birds, and fish. As we talked about earlier, the most common sources of Salmonella infection come from reptiles and amphibians, which naturally contain the bacteria in their intestines and defecate the bacteria in their droppings. After defecation, if the animals stay in the same contaminated environment, the bacteria may spread from the droppings of the skin to the animal. After this happens, handling or interacting with the animal may cause the bacteria to spread to the human who's interacting with the animal. That's why it's important to wash your hands after handling your pet lizard or frog or gecko, or really, you should probably wash your hands after handling any pet animal for that matter. After the bacteria enters the human body, the bacteria will begin to colonize inside the colon and will invade the intestine. Shortly after this occurs, the host will begin to experience the symptoms of Salmonella due to their body's inflammatory response to infection. Furthermore, the bacteria may also produce cytotoxins that prevent protein synthesis. All these different things will bring about the symptoms that we so commonly see with those who have food poisoning, which Shannon will now talk to us about.
Hi everyone, my name is Shannon Giles and I'll be continuing the second half of our presentation on salmonellosis, starting with the signs and symptoms. The most common signs of salmonella that you will observe are vomiting, diarrhea, chills, and on rare occasions, blood in the stool. Other symptoms that patients may experience are nausea, abdominal cramps, headache, and a low-grade fever. Both signs and symptoms generally last between 2 to 7 days. However, diarrhea can persist up to 10 days. As discussed previously, salmonellosis or salmonella exists in many forms or types. These are referred to as serotypes, meaning groups within a single species of microorganisms that share distinctive surface structures. There are more than 2,500 known serotypes for salmonella. Less than 100 of those account for most human infections. Two of the most common types are Salmonella serotype typhimurium, which carries a strain of typhoid fever, and Salmonella serotype enteriditis, which carries the strain for gastroenteritis. In terms of infection rates in the United States, Salmonella is cause to 1 million foodborne illnesses. Out of that 1 million, 19,000 result in hospitalizations and also cause 380 deaths annually. Of all illnesses, Salmonella accounts for 1.2 million illnesses annually, and 450 of those result in death due to a non-typhoidal strain of Salmonella. The following is a map representing Salmonella outbreaks in terms of case numbers as of August 11, 2017. Regions shaded in dark blue represent a higher prevalence in cases, 20 to 31 to be exact, in California, Tennessee, Kentucky, and Ohio, whereas regions highlighted in tan represent states with only 1 to 4 cases reported. Infection rates worldwide. 1/3 of all foodborne illness-related deaths occur in children under the age of 5. 1 in 10 people worldwide fall ill to contaminated foods. That's 600 million people. 420,000 of those occur in adult deaths and 125,000 of those deaths are child deaths. Diarrheal diseases are responsible for more than half of the global burden of foodborne diseases. The following is a geographical mapping of countries most affected by the typhoid-containing serotype of Salmonella called Salmonella typhimurium. Regions most affected are highlighted in dark gray, meaning that they have at least 100 or more cases per 100,000 people per year. Regions highlighted in teal means that these countries have at least 10 per 100,000 people per year. That's 10 cases. And then regions shaded in white, such as the United States and Canada, have less than 10 cases per 100,000 people per year. Methods of treatment. In mild cases, methods of treatment prescribed are replacement of fluids and electrolytes, which is the number one method of treatment for anyone that is dealing with vomiting or diarrhea, because that's where most of our fluids are lost. Doctors recommend that patients eat ice chips if they're having stomach issues and plenty of rest. Another method of treatment is being prescribed an antidiarrheal, and a common one that's prescribed is Imodium AD. And in mild cases, lighter dosage of antibiotics can be prescribed. However, this is usually a cautionary treatment because the use of antibiotics can prolong the symptoms of diarrhea and also cause a secondary infection, which we've read and learned about this semester, called Clostridium difficile. And so usually they're not prescribed in this case for mild cases. And then for children, it's recommended that they take a oral rehydration solution. And an example of that is Pedialyte, and there's also what's called Pediasure. In severe or complicated cases, patients can be hospitalized due to severe dehydration. And so in this case, they will receive intravenous IV fluids since they're not able to keep them down themselves due to excess diarrhea or vomiting. And oftentimes, heavier dosages of antibiotics are prescribed because if the infection is found to be in the bloodstream, the patient now has what's called sepsis, and that has to be treated as well. Methods of prevention. Number one is don't rinse raw chicken in the sink. By rinsing raw chicken in the sink, we're actually spreading those germs all over the counter and the surface of our sink. And therefore, when we have dishes or any other type of produce in the sink, that raw chicken is now able to spread and cover those other things that are in the sink. Cook all foods to proper temperatures, specifically for poultry, that's 165 degrees Fahrenheit, and they recommend that you use some sort of meat thermometer if you have one on hand, or buying one. They're usually pretty cheap and easy to find. Always thoroughly wash your hands before and after you've cooked food, especially when handling any sort of raw meat. Always clean off all of your cooking surfaces, especially where raw meat has touched a countertop. You definitely want to make sure that that's cleaned with hot water and soap. Never cross-contaminate your foods. When it comes to cutting boards, the biggest thing is designating a cutting board for your raw meats, and then also designating a cutting board for all your other produce like fruits and vegetables, so you can avoid that cross-contamination. You never want to stick an apple or cut up an apple on a cutting board that you just used to cut up raw meat, such as chicken or steak. That's just cause for contamination right there. Always keep your food stored at proper temperatures. Never leave raw meats out on the counter to come to room temperature and then expect to stick them back in the fridge and hope that they're going to be okay. That usually is a major cause for bacterial growth. So always keep your meat stored in the fridge at the proper temperatures, and also in the freezer to avoid freezer burn. Avoid eating raw foods, and this does include cookie dough. Cookie dough itself includes raw eggs, and I am a culprit of eating raw cookie dough, to be honest. It is rather tasty. However, it's best to avoid eating any sort of raw foods when possible. And then last but not least, try to avoid any direct contact with reptiles when you are planning on cooking any sort of food. And this includes frogs, lizards, turtles, fish, any sort of wildlife, and even birds, to be honest, even though that's not necessarily reptile. And if you do happen to come in contact with these or you have these as a pet, it's best to make sure that you're washing your hands with plenty of soap and hot water before you handle any sort of food. And just to end our presentation with a little bit of humor, here's a joke for you. It says, "Nice try, Mr. Gibbs, but Salmonella is not a player with the New York Yankees." Did you get it? Once again, thank you for taking the time to view our presentation on salmonellosis. My name is Shannon Giles, and the first half of our presentation was given by Lindsay. We hope you enjoy learning about this bacterium as much as we did. Thank you.